Welcome to Your Health. I'm your host, Rhonda Alfred. For over 4 decades, Cardiovascular Institute of the South and Terrebonne General Health System have partnered to bring cardiovascular excellence and leading technology to the Bayou Region. With a legacy built on expertise, dozens of new cardiovascular procedures, devices, and innovations were pioneered, setting Terrebonne General and CIS apart from any other program in the state. Joining us on this episode is Dr. Peter Fail and Dr. Shane Prejean, Interventional Cardiologists at Cardiovascular Institute of the South, who will talk to us today more about the structural heart program here at Terrebonne General. Welcome to the show, Dr. Fail and Dr. Prejean.
Thank you.
Thank you for having us.
Thanks for being here today. All right, well, let's get started with you telling us more about yourself and your role at CIS. Dr. Fail?
So I joined CIS in 1996 as an interventional cardiologist. Started the structural heart program here probably around 2005, 2006, and have been leading that since then. Shane joined us 2 years ago, 3 years ago?
3 years ago.
3 years ago, and has been taking over a lot of the innovation that we've been able to do over the past 20 years.
A protege, right? Somebody to help fill those big shoes.
Exactly.
Yeah. So I joined in 2021 and have just been trying to add to the program and build upon the legacy that Dr. Fail has built here. It's been very successful over the years.
All right, well, let's get started about telling us about what kind of conditions do you treat with the structural heart program?
So structural heart basically is what has been taught is those interventions in the heart that are not cardiac or not coronary. So Shane and I do aortic valves, we do mitral valves, we do tricuspid valves. We do what's called left atrial appendage exclusion, which is basically a procedure that we do for those people who can't take anticoagulation and atrial fibrillation so they don't get a stroke. Those are the major groups. And then we have a really big research forum that we do in other innovative technologies.
Okay, but in layman's terms, what kind of conditions does this treat?
So this can be anywhere from valves in the heart. So valves are meant to keep blood flowing in the right direction, so they can either leak or they can get too narrowed or stenotic. Patients can have holes in their hearts, and then, like Dr. Fail said, there are alternative treatments for patients for AFib that take blood thinners. We can potentially close off an area in the heart to reduce their risk of stroke without the need for stronger blood thinners.
Okay, some amazing things are taking place for sure. So what types of specialized treatments do we offer here at Terrebonne General that you can't find anywhere else in the state or region?
Well, regionally, we're the only center that performs the TAVR, the TAVR, the mitral clip, the tricuspid clip, left atrial appendage. And then some of the research programs we've done in tricuspid are innovative only to us right now. That'll slowly go to other programs, but right now we're the only one in actually this part of the country that's doing it.
So we have people traveling from all parts of the state and across the United States to get treatment here, correct?
Yes, ma'am.
Correct.
All right. You two were recently involved in a first in the state procedure. Can you tell us about this new technology?
So that procedure was what's called a tricuspid clip procedure. So when someone has a leak in their tricuspid valve, traditionally the only option for patients was a surgical procedure, like an open heart procedure. Our program here with CIS and Terrebonne General was actually involved in the research trial that got that device approved, and then we subsequently were the first program in the state to actually have access to that device. So with the leadership of Dr. Fail, we performed the first tricuspid clip for commercial use in the state of Louisiana.
Yeah.
Well, very impressive. So patients don't have to have an open heart procedure with this?
Correct. All the therapies that we're talking about are catheter-based. So while we do have a comprehensive cardiac surgery program, and for patients who have indications for surgery, we recommend that in those patients. We also have alternatives with catheter-based therapies where we can repair valves, holes in the heart, and other structural heart conditions with a catheter, offering a less invasive approach and a quicker recovery.
Okay, since we do have one of the largest programs in the state, what does this mean for patients in our area and region?
I think expertise. I mean, we've been doing it for a long time. That helps us. I think we've seen most of the subtle nuances of these procedures. Have been able to, when we first started doing aortic valves, it was an all-day procedure, and now we're doing 4 and 5 a day. So dramatically improvement, not only in technology, but knowledge of how to do these procedures. So I think that experience offers a lot to the patients, that we've been able to get patients through the sort of the entire workup very quickly, get the procedure done, and get them home to their family very soon.
Dr. Prejean, did you have something to add?
Well, I think it's important to realize what we've had for many decades here just in Houma, Louisiana. You know, I'm from the area. I always knew about CIS and Terrebonne General, but to really see it in practice, it's phenomenal to see the level of care that can take place close to home here in Houma, serving the Bayou Region, but also serving patients that come from other places to get these state-of-the-art treatments with our structural heart program.
Yeah, people just don't realize the gem that we have right here.
Exactly.
So what kind of impact, we've had a relationship for 41 years. What kind of impact do you see this having in the next 40 years to come, moving forward?
Hopefully I'm not working the next one. Well, Dr. Prejean will be leading the program by then, you know, for sure. I mean, I think that you know, the evolution and you know, what Shane had said, we work very closely with our heart surgeons, and they are part of our heart team, so to speak. And so we work back and forth about finding what's the best way to take care of patients. And I think you're going to see that evolve in more technologies and more research projects that we're doing. It's amazing the number of people who will give us a call and say, we've got a new widget that may help us with this. And we've been in a lot of the early research projects being able to take that to commercial.
Well, that's amazing. Well, thank you so much for what you're doing to save lives and for people with heart problems.
Our pleasure.
Appreciate y'all being
Thank you.
here today. For more information about the structural heart program at Terrebonne General, visit tgandcis.com. Thanks so much for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.